So calls for a fourth vaccine are growing louder as a new subvariant of Omicron is fast becoming the dominant strain of COVID-19 in Ontario. Health officials are pushing for the province to expand the eligibility for second booster doses to defend against the highly transmissible BA.5 subvariant. Research from Harvard Medical School shows the BA.5 may escape antibody responses among those who've been infected with COVID-19 before and those who've been fully vaccinated. The chances of severe illness and hospitalization are still reduced, though, for those who are vaccinated. With me now is Dr. Marla Shapiro, CTV News medical contributor. Dr. Marla, good morning to you. So what are your concerns thus far about this new variant?
So exactly as you stated, this new variant does seem to be able to escape the existing immunity that we see with vaccines, although there is some protection. That's why there's movement towards the fall looking at what's called a bivalent vaccine, which has the original vaccine in it plus an Omicron variant, hoping that we'll get greater immunity to what we expect will be the new variant of concern, as we're seeing BA.4 and BA.5 now pick up at this present time.
So that new vaccine on the horizon, then, would that be considered a whole new shot, a booster? Is it for everybody?
Well, think about the flu vaccine and how the flu vaccine changes every year. This is the idea of being responsive to what we're seeing and trying to predict what is going to become the most important variant and tweaking the vaccine, if you will. So again, we're not thinking about so much as are your series completed as much as are you up to date? And that's the concern that we'll be looking at, who should get what and when they should get it.
Good point. So in terms of the transmission rate of this new variant, what should we be watching for and how will we know if it's being spread and spread quickly?
So I think, we always look at the wastewater to see what's happening in the wastewater, but clearly what happens in hospitals and admissions. When we look at the fourth shot in the Israeli data that was recently presented, we know in an older population, the vaccine did make a difference. About a third of individuals didn't get the illness. It kept about 2/3 of people out of the hospital and about 72% from dying. So there still is protection from that fourth vaccine. But I think, most of us have been looking at that fourth vaccine as who is the population at greatest risk, and that typically has been the population in long-term care, congregate living, the usual things that we've heard over the past little while. So should everybody getting the fourth vaccine at this particular point? That is a debate in public health, and you see across the country, for example, in Quebec, it's anybody over the age of 18, the new data coming out of the Maritimes in terms of who can get it, but at the same time, the caveat, maybe you should wait. So it's a little bit patchwork quilt of information depending on where you live and eligibility.
And Dr. Marla, we're talking about fourth doses, but a lot of people didn't even get their third one. So does that make them vulnerable to this new variant?
No question, that number is about 48%. And we do know that 2 doses simply is not enough. The vaccine itself wanes over time, and that's why that third vaccine has been recommended. So before we even move on to the fourth vaccine for the high-risk population, we really need to, express to Canadians the importance of getting that third vaccine and how it does boost your immunity.
Dr. Marla Shapiro, thank you so much for that. Appreciate it.